some commentators believe the worst of the pandemic may actually be over as South Africa sees a drop in the number of daily COVID-19 infections since a spike was logged back in July. Now, the National Command Council has met to discuss the trajectory of this pandemic, and an announcement is expected on some of the lockdown regulations soon. Health Minister Dr. Zweli Mkhize says the country has also seen a drop in hospital admissions, but warned that the possibility of a second wave in the coming months is still alive. Senior researcher at the Council for Scientific and Industrial Research, Dr. Ridhwaan Suliman, says the rate of infection is stabilising and positive testing outcomes are encouraging. He, we understand, is tracking COVID-19 in his personal capacity and joins us now live via video link. Doc, thanks very much for your time and welcome to the AM report. Let's start with that point of clarity. You said to be tracking the pandemic in your personal capacity. What does that entail?
Good morning, Ayanda. Thanks for having me. Basically, I have been tracking the data and all the numbers over the last 5 months. I've been sharing that on my Twitter profile and just been looking at all the different measures to get an understanding of where we're at and a bigger picture, telling a fuller story, basically.
This morning is quoting Dr. Nyathi, who's from Stellenbosch University, if my memory serves me correct. And essentially, this health expert was saying that talk of a second wave is a bit of an exaggeration. In fact, I think the term used was, it's dramatic. Do you agree with that? Or let me just ask, to what extent would you agree with that sentiment that, you know, the fact that we might see the high numbers we've seen in the past is a bit of a stretch?
Indeed. I think it's way too early to even be speaking about a second wave. In fact, we're still in our first wave, even though we seem to have passed the peak numbers in terms of the national data. We still need to get over this particular wave, and we need to drive these numbers down. And there's always a risk of further outbreaks, and there's a risk of second waves and multiple waves thereafter, as we've seen from other places and countries globally. But I think at this stage we really need to focus on the numbers at the moment, and we need to focus on driving that infection rate down all the way as close to zero as possible.
And the numbers themselves are but just one indicator of the pandemic. There's the number of deaths, which according to the last 24-hour cycle report, are standing at 130 or so. There's also hospital admissions to be considered. Are we doing enough to contextualize what appears to be a stabilizing COVID-19 infection rate?
It's a good point. I think it's important not to look at any one particular measure in isolation. We need to look at various different indicators. At the same time, each of the different measures have their own limitations and nuances. So yes, while the daily COVID-19 infection numbers have stabilized and are somewhat decreasing, there are nuances to that, and one needs to also look at the hospitalization numbers and the death numbers, the latter which is still increasing. And one needs to look at all of these indications tracked over time to get a story of what is actually happening.
You speak about nuances. I remember at the beginning of the lockdown period, there almost appeared to be an acknowledgement of this complexity, with government saying that they are exploring the idea of having different provinces at different stages of the lockdown. I'm not quite sure what actually happened to that conversation, but you've looked at the numbers. In hindsight, or perhaps even looking forward, do you think that kind of strategy would be helpful at this stage of our pandemic?
Absolutely, as you say, and as we have seen, the rate of infection has grown at different rates in the different provinces, and we've seen the timing of the outbreaks has varied within the different provinces. And you can see that clearly by looking at all of the numbers and the data. I do believe that it would make sense probably going forward to try and manage the outbreaks on a localized level, or perhaps look at localized lockdown measures. I do understand the practicalities and challenges thereof, but we do know that, there is always a risk of further outbreaks and super spreading events, and we need to find a way to manage that, I believe, at district and at local level.
There's also been a lot of talk about testing, Doc, in the recent days, and an ongoing conversation had been around the idea that if you test more, you're likely to find more tests, and that has made its way into the conversation about why we're seeing fewer numbers. But I'm interested in the implication in the language that we've been able to use since the outbreak began. When we say a place is an epicenter or is experiencing the most intense outbreak, how accurate is that really, considering that this hinges so much on your testing capabilities?
That's a fair point and a very valid question. Of course, more testing equals more cases only when you're not doing enough testing. If you've got high test positivity rates, essentially the number of cases, number of positive cases as a percentage of tests, then you will find more cases when you test more. However, if you have low test positivity rates, 1 or 2%, then if you're increasing the testing, you're not going to see a significant change in the number of infections that you do find. So yeah, more testing does equal more cases, but only when you're not testing enough. So one needs to consider the test positivity rates, and at the moment that particular measure is quite high currently in South Africa. And I do think it's really important to note that testing is a vital tool to combat the virus, to get ahead of the curve. One can use the testing together with quick turnaround times and efficient tracking and tracing as a weapon to fight the virus if you're doing it as an attacking weapon and to try and understand where the virus is spreading. If the testing is not sufficient and does not scale adequately with the size of the outbreak, then you're using it more as a diagnostic measure rather than as a tool to combat the virus.
So from what you're saying, we should actually be focusing more on the test positivity rate more than the number of absolute tests that we're actually conducting.
Indeed. And if you look at the recent decline in the number of COVID-19 cases, I think it's a function of two aspects. One is there is a stabilization and slight decline in this particular measure, the test positivity rate, but the actual absolute number of tests has decreased over the last 3 weeks or so. We currently, if you look at a 7-day average, averaging around 28,000 tests a day, down from close to 50,000 tests per day. So that certainly is a factor that influences the decrease in the number of cases that we're seeing. So if you look at the test positivity rate, I believe you get a better or at least another indication of where we actually stand in terms of the rate of growth of infection.
Interesting insights indeed. Thanks very much for your time. Really appreciate it. Dr. Ridhwaan Suliman is a senior researcher with the CSIR. Appreciate your time indeed.